Good afternoon, everyone. On the day before the State of the Union, WRI is delighted to be hosting this exceptional group to engage in a discussion on the Clean Air Act, past, present, and future. My name is Manish, Bapna. I'm the acting president of the World Resources Institute. For those of you who aren't familiar with WRI, we're a global think tank that focuses on sustainability and development. We use analysis and partnerships to develop solutions for some of the world's most pressing problems. And one of our major initiatives is working closely with the Hill and the business community on climate and energy issues here in the United States. Protecting public health from air pollution has historically been a bipartisan issue. This goes back to the passage of the Clean Air Act in 1970, when Bill Ruckelshaus served as the first EPA administrator under President Nixon. It was reaffirmed in 1990 when the Clean Air Act was amended, as EPA Administrator Bill Riley served under President George H.W. Bush. One thing we can agree on, regardless of political party, is that everyone wants to breathe clean air. We are, of course, honored today to have both Senator Carper and Senator Alexander as our co-moderators for this event. Senator Carper has a distinguished record on protecting clean air and serves as the chair of the subcommittee on clean air and nuclear safety. Senator Alexander also has a distinguished career in the Senate, including serving in a leadership position for the Republican caucus. And both Senators Alexander and Carper are members of the Environment and Public Works Committee, and they worked closely together, co-sponsoring a number of pieces of bipartisan legislation, including around important environmental issues. We're also very pleased to welcome Bill Ruckelshaus back to WRI. Bill is a longtime friend of the Institute's and is Chairman Emeritus of our Board of Directors. And I'd also like to welcome former EPA Administrator Bill Riley here today. And we're delighted to be joined by a number of other expert panelists. Mr. Ralph Izzo, right here, Chairman of the Board, President and CEO of Public Services Enterprise Group, one of the top 10 largest utilities in the country, based out of New Jersey. Mr. Dan Greenbaum, President and CEO of Health Effects Institute, and Dr. Sumita Khatri, co-director of the ASTHMA Center for the Cleveland Clinic. Before I turn the floor over to the senators, here's the setup for today's event. The event will be moderated by both Senator Carper and Alexander. At 4:30, the discussion will be wrapped up and reporters will have an opportunity to ask questions to the panelists. We note that Senator Alexander will need to leave by 4:45. And at 5 o'clock, we invite everyone to join us for a reception in our lobby to continue the conversation. So thank you all for joining us today. We look forward to a lively conversation. Let me now turn over the floor to Senator Carper. Thank you.
Our thanks to test. There we go. Our thanks to you and everyone at WRI, including the Chairman Emeritus. You have more things on your resume than I could ever dream of, both of you. So we're honored to be here with all of you. Sumita, very nice to see Ralph and Dan. Welcome, and it's a special treat to be here with Lamar. I actually emailed Lamar, who was on leading a congressional delegation on the other side of the world, and I emailed him, oh gosh, a week or two ago, and I pleaded with him to come and be our co-moderator and co-chair, and he was good enough to do that. And so, Lamar, one of my favorite buds. It's great to be here with you and to do this. Lamar has some of my favorite sayings, and one of them, he talks about hearings. He says they shouldn't be called hearings; they should be called talkings, because that's what senators do when they get there. They talk, and we don't really hear much. We like hearing the sound of our own voices. And so sometimes we talk a lot. We had just a great poultry summit today on Delmarva, where we had folks from the poultry industry, environmental community, regulators, non-regulators, a number like senators from a couple different states. And it was just a wonderful opportunity for us to listen and to learn a whole lot. I think one of the most extraordinary meetings actually I've had in the last 11 years. I have high hopes that this one will be another one much like that. I've always believed that Lamar's heard me say this a time or two. I think it's possible to have clean environment and a strong economy. When I ran for governor in 1992, but believe it or not, Lamar, the most asked question I received in that campaign, we're just coming out of a recession, but the most asked question I received was, I was then a congressman. It was, Congressman Carper, do you think we can have a strong economy and a clean environment? Literally, that was the most asked question I was asked in 1992. And I said, yeah, I think it's a false choice to say that we have to have one or the other. We can have both, and for the next 8 years after that, we did have both. Made great gains in Delaware on both fronts. Before I moved to Delaware, I'd been a naval flight officer and spent some time at Ohio State University. And I remember when there was a river up in Cleveland, Cuyahoga River, some of you will recall, caught on fire. Do y'all remember what year that was?
1970.
Yeah, I think it was about a year or two after I graduated. So and went off to be in the Navy, and I ended up squatting out on the West Coast, Moffett Field, just south of San Francisco. Our job was to hunt for Red October to track Russian nuclear subs when we were over flying missions around South Vietnam and Cambodia. And we weren't very good at chasing submarines. In fact, we could barely spell submarine. But by the time we left, we got to be pretty good. And we were very proud of that. But one of the things we weren't so proud of is in 1969, when I showed up in Moffett Field and joined my squadron and get ready to go to Southeast Asia, we're about to begin, and in fact, we just finished in 1969 some really bad air days, not hair days, bad air days. And I think that year they had something like 65 bad air quality days in the Bay Area, in San Francisco in particular. That's about 9 weeks, if you think about it, that the city there and the people who lived in that area had unhealthy air that went well beyond health standards. Fortunately, the next year, a Republican president. I'm one of the few Democrats that ever quotes Richard Nixon, Richard Nixon used to say, the only people who don't make mistakes are the people who don't do anything. That's pretty good, isn't it? Well, one of the very good things that he did in 1970, working with the Democratic Congress, and the fellow here on my left, is he came up with clean air legislation that's designed to protect our environment and our health. And I might be wrong, but didn't the final version of the Clean Air Act in 1970 pass both houses unanimously?
No, there's one vote against it in the House.
Was that Ron Paul? No, he wasn't there yet.
He wasn't there, but he would have.
Well, a little over 20 years ago, the Congress wasn't debating how to weaken or delay our clean air laws. We're considering bipartisan legislation, that could improve our clean air laws and actually make them stronger. About 20 years later, I'm told, and Bill, you can correct me on this, but I'm told that close to 90 senators, maybe 89 to be exact, actually voted for the Clean Air Act amendments of 1990. I was a House member at the time. 401 to better protect public health, while a Republican president, again, this time George Herbert Walker Bush, signed it into law. And I think most of us would, that we're better off for that. Since President Nixon signed the Clean Air Act, we've seen some $30 in return benefits, I'm told, healthcare costs, better workplace productivity, save lives, about $30 in return for every $1 that's been spent. In other words, fewer folks are getting sick, missing work because of the Clean Air Act. And since President George Herbert Walker Bush and signed the bipartisan Clean Air Act amendments of 1990, electricity rates, I understand, have stayed constant, but our economy has grown in real terms some 60%. Now, compared to 1969, the state of our nation's air, as I think we all agree, is a whole lot cleaner and safer today. For example, San Francisco may now see only one bad air day not in a week, not in a month, but in a year. But not every town is that lucky. 154 million Americans are still living in areas with bad air quality, and we can and must do better for the health of our nation. We know more than we did about 40 years ago, even more than we knew about 20 years ago, about how pollution impairs health, how it travels, and just as importantly, how it can be cost-effectively cleaned up. Unfortunately, in Congress, we seem to be distracted some days, well, many days, by debating about the merits of public health science rather than working together to figure out how we can make reductions in pollution at a lower cost. And I hope during today's discussion we can remind folks that clean air is not a partisan issue. It wasn't then and shouldn't be today. It's a public health issue. And I look forward to having an open and thoughtful dialogue with our panel, with my friend Lamar, and on the strides that our country has made to reduce air pollution and the steps we still need to take for a cleaner, healthier environment and a stronger economy. Ellen.
Thanks, Tom, and thanks for your, one of the rules of Lamar Alexander's little plaid book is if you want an applause, seat a few friends in the front row. That's one of the, so I'll lead the applause for Tom Carper. I appreciate the invitation. Thanks to everyone for coming. I'll do my best to listen this afternoon. I'm looking forward to learning. Tom and I have introduced bipartisan legislation on clean air every Congress since I've been here, since 2003. And I'll sort of start where he did. I was actually in the cabinet room in 1970 when President Nixon outlined to the Republican leadership his concern about the environment, and it was he was pretty far ahead of the crowd at the time. Nobody paid much attention to him in the room that I could tell, because it was not a new issue yet. But that was the year of Earth Day, and that was the year that there was suddenly a lot of concern about the environment. And I watched Senator Baker and Senator Muskie work on the health care laws together, and I was in President Bush's cabinet when he took a great deal of pride in the Clean Air Act amendments of 1990 and 91. And I live in a county in East Tennessee where we haven't elected a Democrat to Congress since Abraham Lincoln was president, and don't intend to. So, but we're all for clean air. And the reason is because when I walk in to see the Chamber of Commerce or the next county, they say their #1 economic development issue is clean air. That's because we have the Great Smoky Mountains, 9 million visitors, and people want to see the Great Smokies instead of the Great Smoggy Mountains. So I was pleased to see that the Smokies clean air specialist, Jim Renfro, whom I know well, said the other day that if you stand on the top of Clingman's Dome, the highest mountain in the Smokies, about 6,600 feet, on a good air day, you can see an average of 81 miles compared to the 61 miles you would have seen 10 years ago. But there's a way to go, because the Cherokees could see 113 miles before human pollution made a difference there. And that was years ago. And on a bad air day, it's 19 miles. So you can see from a visibility point of view. And as a governor, I watched Nissan come to Tennessee, and the first thing it did was go down to the Air Quality Board and get a permit for its paint plant. And if it couldn't have gotten one, it would have gone to Georgia. So we see how clean air makes a difference, not just in health, but in visibility, so we enjoy the mountains, and in creating jobs, whether it's tourism, whether it's auto plants. I think the reason why, and this will be my concluding comment, there's probably a reason why there's more division today over clean air than there was before. And that's because we're getting to the last chapter, or at least the next chapter, of cleaning up the air. At least, and I'm talking now really about SOx and NOx and mercury. I don't deny that carbon is important, but I think we know what to do about the first three. We ought to go ahead and do it, and then we can continue to discuss how to deal with carbon as we go along. And I'd like to hear some comment today about #1. I think because we're in a different era and the issues are more difficult as we get into this next chapter. One, I think Congress ought to get more involved so the EPA can be less involved. I mean, you look at the Boiler Mac issue, which has 42 co-sponsors to change the EPA rule, 12 of them Democrats. One of the problems is the EPA doesn't have the authority to do what it needs to do. That's one. And the second is the amount of time. Congress ought to be dealing with that, not just the EPA. And on the cross-state air pollution rule, which I support, one of the problems I have with support is I think it requires things to move more rapidly than they need to get a result, and it suddenly included 3 new states, which I think Congress probably wouldn't have done if Congress were writing the Clean Air clean air rule. And third, I think we ought to have a discussion about, be honest about costs. Does the price of electricity and the costs of jobs make a difference here? We say they don't in some cases, but then you have President Obama's advisor pulling back the ambient air quality rules when everybody knows the real reason for that was the costs that it imposed on many communities across the country. And so I think we ought to, one, think about Congress getting more involved in the kind of legislation Senator Carper and I proposed. Number two, I think we ought to address the question of agreeing on standards, but then giving utilities a little more time. Because we'll get there by the time if we'd had more generous time to reach where we were going, we'd already be there, and we wouldn't have been in court for all this amount of time. And then third, I think we ought to take another look at that we wouldn't have had to take in 1970 or even 1990 and 91. Should we take into account economic costs, and if so, what would be the right way to do it? So I look forward to this. I come as a strong supporter of clean air legislation, and I look forward to learning. Thank you.
Chairman Emeritus, Mr. Ruckelshaus, Administrator Ruckelshaus. What do people call you, Administrator?
Oh, they call me a lot of things.
All right, we're delighted that you're here, honored that you're here. I think so. There you go. See, the light comes.
Oh, yeah, okay.
All right.
Well,
You can take, my notes here say that I should ask you to speak for 2 or 3 minutes. You can talk for 2 or 3 hours. All right, well, maybe not quite that long.
I know, but I'd say the same thing as I would in 2 or 3 minutes.
Oh, well, then it's just 2 or 3 minutes. That's good.
Senator, thank you very much for inviting me and all of us, both you, Senator Carper, and Senator Alexander. We know you have studied these issues for years and are a huge help in the Congress in trying to cope with what is a complex situation. Let me try to set a stage in a very few minutes here on the basis of what the country looked like when the Clean Air Act first passed and what the difference between that is and today. The Clean Air Act, as all of you know, passed in 1970. In fact, took effect the 1st of January in 1971, which was just 30 days after EPA opened its doors, not in Waterside Mall, that was later on. We were on K Street at the time, if you can believe it. That's right. In any event, there was a combination of things that led to very strong public support for change. There was a book written by Rachel Carson which had an enormous impact on the public prospectively and cumulatively over the decade of the 70s. That book was called Silent Spring. It was attacked by scientists as not being entirely accurate, but she struck a chord in the American people that was very effective. Something that has been missed, I think, in all of this is as the pollution problems expanded in those days, color television marched into our living rooms in the middle of the decade of the 60s and marched black and white television. Color television is a lot more impressive with a yellow outfall flowing into a blue river than is black and white. We had a war that was very unpopular that people associated with the lack of care of things like, in a broad sense, nature. That plus the fact that we had some real problems. It wasn't all just part of people's imagination that these things were happening, or an influential book or other policies unrelated to pollution. We had rivers that caught on fire. We had air pollution that was so thick you could see it. So when people went to work, what they were seeing on their television screens was reinforced by what they saw on the way to work. They could see raw sewage outfalls flowing into rivers. They could see smog primarily caused by the automobile in most parts of the country, including here in Washington, D.C. When I moved here in 1969 as part of the Justice Department in the Nixon administration, smog was a daily occurrence and was something that you could very visibly taste and smell and see. It was not related to big industrial discharges. It was all related to the automobile. Well, the result of all that was a public deeply concerned about the environment. They were demanding that something be done. The process we had up to that point was to have the states do the regulation of industrial and municipal kinds of pollution, unrelated really to what any federal program was. The states didn't, I was part of a state program in the state of Indiana. The states weren't very good regulators of industry because they competed so strongly for industry to be located within their borders. So the answer that the Congress gave to this mix of public demand and problems was to create in the Clean Air Act a process where the federal government set the standards, the health-related environmental standards for ambient air quality, and the states were given the responsibility, but through the adoption of the state implementation plan, to determine how those standards were to be implemented. The costs were really taken into effect at the state level, not at the national level, because the standards were set specifically in the statute without regard to cost. Senator Alexander has suggested that we might revisit that question. I think that's a good thing to revisit, frankly, is how do you take costs into account in trying to determine what the appropriate regulatory program is for pollutants. Well, the Congress, as well as the President, responded to, as I mentioned, EPA was created, the Clean Air Act, the Clean Water Act, the Safe Drinking Water Act, all passed within a very short period of time. There were 16 major pieces of legislation passed in the 1970s, most of them under President Nixon. Again, I can tell you firsthand, the issue of the environment was not top of mind with President Nixon. Not because of any animus toward him, it was just nothing that he had worried about in his several political campaigns before running for president. It wasn't something that his constituents were demanding. All of a sudden, when he became president, it came to the top of the list in terms of public concern. So he responded, as did the Congress. That's not a bad thing. That's the way democracy is supposed to work. The public demands something happen. The Congress, the president responds, and programs are put in place to alleviate the public concerns. Since that time, as anybody, and certainly Bill Riley can attest to this in his own tenure there at EPA, we have made remarkable progress under the Clean Air Act in addressing these early problems associated with air pollution. Whether it's the automobile industry, when I was first at EPA in 1970, I suppose I spent 60% of my time on the automobile as an air pollution problem. That was brought under social control during that period of time. When I went back in 1983, I spent about 5% of my time on that problem. So that kind of progress that has resulted in such dramatic decreases in hydrocarbons, carbon monoxide, and nitrogen oxides from the automobile is a testament to the effectiveness of the Clean Air Act. It was not without controversy. Believe me, there were plenty of people upset with everything EPA was doing at the time, but the public support was so strong that it greatly affected the political support for what the agency was doing. That, I think, is a difference today from what was true 40 years ago. And it is one of the things that's made continued progress, not without some contention. There's always going to be contention in an area like this, but it's what has made progress today more difficult. Much of the progress that we've made is not visible to the public today. They don't remember what it was like back in the late 60s and early 70s when all this stuff started. And their lack of awareness results in the lack of political pressure, political public opinion demands on the Congress that this effort to restore our environment, to protect public health, continue. And let me make just one last point, and that is, as we've seen in the series of debates for presidential candidates, the whole question of freedom is discussed in a variety of ways. And my own view in watching it is that there is a lack of understanding in some cases on the nature of freedom in a free society. If I step back to the year I was born, 1932, there were about 2.1 billion people on Earth. Last October, we passed 7 billion people. That's more than triple in my lifetime, the number of people that were accumulated on Earth from the beginning of time. In addition to that, that number of people, there are more of us, we have more technology, we have more wealth, we have cumulatively more impact on the environment than we did were even close to back in 1932 when I was born. So the necessity of having that number of people with the kinds of technologies that we have developed and the wealth that has been generated around the world, it's hard to remember times like this of economic stress about that wealth, but it's there. And the impact that all of that has on the environment is really significant. But what it suggests is that we need a set of rules to guide human and corporate conduct. Or we're and that's particularly true in areas like social regulation, health, safety, and the environment. It probably is also true in economic regulation, but it is particularly true in social regulation. That if we don't have a system of restraints that really defines freedom, we are not going to succeed as a society, whatever our other attachments to different kinds of freedom are. Freedom in this area, in human and corporate conduct, is not the right to do anything. It's not the absence of restraint, that's license. But developing a system of restraints that has within it as rational restraints as we can make them, as fair, as culturally acceptable, as efficient, as effective, and restraints that maximize choice. That's really what we should be seeking in terms of our legislative administrative process of imposing these restraints. And if we do that, in my judgment, we then define freedom in such a way that we'll be able to progress both economically as well as ensure that both public health and the environment are protected.
Thank you very, very much for those words. Bill Riley, great to see you. I don't know whatever you guys are drinking. You both look great, by the way, don't they? Don't they look terrific? What? That's right. I don't just says what clean air and clean water will do for a guy. So.
That's right. Just keep you vital.
There you go. Well, we're very happy that you're honored that you're here. But ask you just to proceed. Thanks for.
Well, I'd first like to say, Senator Carper, Senator Alexander, both of you have been very involved in the most constructive and imaginative ways in trying to make a success of not just this area of public policy, but so many others. And I think this is a good example of a public service at a timely moment. I would begin with the success of the Clean Air Act. There are so many areas in which government, its policies and programs have failed us, have failed to meet the terms in which they were set or the objectives that were delineated by the Congress. This isn't one of them. It is astonishing what the Clean Air Act has achieved in its 40 years of history. And I just cite some of the numbers: carbon monoxide emissions down 51% since 1990, much more since 70. Lead down 60%, nitrogen oxides down 44%, volatile organics down 43%, small particulates, which you discovered pretty serious, down 50%, and finally sulfur dioxides down 61%. Those are very significant numbers, and they really do suggest a certain incongruity between the reality of the achievement versus the degree of skepticism about the continuing enterprise. It's very hard to understand the attacks that continue to be mounted against the agency as it conducts the job that Congress set for it, and does so, in my experience, with enormous skill, integrity, and in fact sensitivity to cost. A little understood reality is every one of the major initiatives that I can look back upon, whether it's getting lead out of gasoline or the acid rain issue, or in the earlier time, the catalytic converter requirements, EPA significantly overestimated cost and burden on the economy that would be entailed. Overestimated. An agency that theoretically would have had every impulse to shade it the other way. Most recently, we've heard so many charges that the agency is hobbling the hiring of new people in small business. Well, there is consistent polling that has been done among small business owners, which has produced the result that 80% have said that an EPA regulation had nothing to do with their hiring decisions, and certainly didn't inhibit their hiring. It is not a feature in that problem. I think there is right now difficulty understanding public attitudes, and Bill put his finger on it. We did some polling 4 or 5 years ago at the Nicholas Institute for Environmental Policy Solutions at Duke University, and we asked the question, where is the country on environmental issues, and why is there not much urgency with respect to some of these questions in a way there once was? And we discovered, according to a Democratic and Republican pollster, 2 reasons were given. One, a sense that most of the problems have been addressed. We're victims of our success here. And that's certainly even more complex to address an unseen problem like carbon dioxide, which, although theoretically has the public support to the kinds of initiatives necessary to effect any response to it, would probably not. The second reason was a perception generally held on the part of the public that regulations do impact on the economy. They do cost money, and some of them do. There's no getting around that. The unusual contention that we have right now, I think, has a number of causes, one of which is quite simply the flurry of regulations that's coming down. It just seems like one after another of very far-reaching, very expensive regulations. And I have to say, I agree with Senator Alexander that historically, EPA has often traded timing and allowed delays in return for more significant reductions. And I thought the cross-state rule coming out in July and requiring impact response in January was probably excessive. But by and large, the agency is carrying out the will of the Congress, of very large majorities, as you referred to, in 1990, the Clean Air Act amendments, which clearly contemplated ACT, lead rule, cross-state rule eventually, and most of the other rules that have since been forthcoming. There is a sense that maybe that this administrator is overdoing it, but if you look at why they are coming down now, it's typically because decisions had been either deferred by previous administrations or held up in court, and now as a result of court orders and court settlements, the time has come. And this issue has to be faced. I think it would be very helpful if we could more explicitly characterize to the country precisely the nature of the unmet needs, of the continuing need for attention to these problems, the large amount of the country that is in non-attainment. It will be even greater when the new ozone regulations kick in a couple of years, which we have every reason to believe they will, having been deferred for 2 years this past year. It's also true, I think, that an election cycle is a particularly difficult time to be an EPA administrator. We've probably all done that, and I used to have one rule that I made clear to my staff, that we don't make the oil and the auto industry mad, at least in the same week. And the truth is that EPA tends to make people mad every week, and that's what the White House hears, and that's what the Congress hears. And you have to have a president, you have to have administration that understands that that's the nature of the job. It's a regulatory job, and there are very few benefits that one can confer of a monetary sort. I was asked in China when I was helping them design a new EPA a few years ago, what did you give when someone complied with your voluntary programs? By the way, the voluntary programs were the most compelling to the Chinese of all the things that we've done. They thought the most relevant to their own culture. And I said, well, a nice letter from me and a flag to fly over their plant. Chinese actually thought that was that would be appreciated. But I would simply say that ordinarily one would get, particularly looking at the CO2 problem, and you look at the House regulations, they would do away with the EPA administrators or the EPA's ability, responsibility, authority to regulate CO2. Lead, they would even forbid the Homeland Security Agency from tending to adaptation to climate change. This is a whole series of ascientific, very hard to understand, angry responses to an agency which, in my experience, has extraordinary skill, professionalism, and integrity. More, frankly, than I thought when I went there, because I came out of the environmental community and we'd never been part of the EPA constituency. We were always part of the disappointed adherents of a more pure policy. So the Congress has got to work with, I think, the agency, especially where you have a problem like carbon dioxide, for which the Clean Air Act was not designed. Nevertheless, it is the instrument that is available, and the Supreme Court's made pretty clear that once there has been an endangerment finding, it has to be used. That's not optimal. On the other hand, one would hesitate to bring an initiative were one president to the Congress with a House which is so implacably opposed to what seems to be the whole enterprise itself. That's where we are at the moment, and it does suggest a need to communicate more effectively to the public what has been achieved, what remains to be done, what is actually very important to the country and also the economy. And you think about the Clean Air Act of 1990, it benefited the Northeast very significantly in addressing the acid rain problem. It benefited the West in finding a way, an outlet, a market for its clean coal. And that's the reason the coalition passed it. And that has often been done, and when the charge is made that the EPA doesn't take into account cost, benefit, I think probably the agency is as good at that as any agency I can think of, largely because it has to be. It has to defend constantly against concerns, charges that it may be infringing too much on the economy. And I'm not aware of a single major decision with a significant cost impact that didn't have a lot of attention, certainly in my time, to its economic impact. So I would just conclude by saying government really has worked, if you use air quality as an example. It has worked for the environment, for the country, and the Congress should take pride in it.
Administrator Riley, thank you so much. Dr. Sumita Khatri, I understand you come to us from Cleveland Clinic. You actually know where the Cuyahoga River is.
It's so hard to live that down.
Is it, tell us, does it still catch on fire?
No,
It's been a while,
actually, you
hasn't
should
it?
come visit us and see that it doesn't catch on fire anymore. Cleveland's turned around. Come visit Cleveland, everybody.
I was up to visit the Cleveland Clinic about 2 years ago when we were working on healthcare reform legislation. And as I left that place that day to go down to Columbus where I'd gone to school, I thought to myself, I think I've seen the future of healthcare delivery in this country. What an impressive place.
Oh,
What an
thank you
impressive
very
place. And we're delighted that you're here. Thank you for joining us.
Oh, thank you. I really appreciate this opportunity, Senators Alexander and Carper, for hosting this session for us. And, I have rarely had the privilege of being in such esteemed company as people who are such warriors for public health. And I can't imagine the debates that you had to uphold, and I appreciate that very much from the bottom of our heart and from public health. Thank you very much. And I'm here as a health professional, as a clinical researcher, and a patient advocate. And as Senator Carper mentioned, that I work for an institution that takes pride in its, commitment to the environment and to the community. And so it's, I'm here on behalf of my patients, my professional institutions, my organizations, and my family as well. And so I'd like to give you a little bit of a background and understanding as to where some physicians and healthcare professionals might come from. People choose medicine for various reasons, but in general it's for the greater good, to help people, to alleviate suffering. However, there's also a scientist in all of us. We, for the large part, believe in evidence-based medicine. Otherwise, none of us would agree with vaccinations. No one would believe that germs cause disease and that antibiotics work. But nowadays, we're finding that basic scientific knowledge, which is rigorously reviewed and brought to peer-reviewed journals, is refuted. And these peer-reviewed journals are mentioning that there are associations of health effects with air quality. And even though air quality is improving, that there is still much more work to be done, because although it's not visible, it doesn't mean it's not an issue. I sort of akin this to hypertension, which is called the silent killer. So same as the non-visible air pollution. So I grew up in Cleveland, and I'm a very proud Clevelander. And during training, we decided to move to Atlanta for a short period, and I had no idea what hot meant until I went to Atlanta. And then when we were there, we saw, there's high ozone levels there. And it was there while I had some friends who were studying air quality and research at the CDC. And one of my friends did that very natural social experiment study where during the Atlanta Olympics in 1996, there was a reduction in automobile traffic in downtown Atlanta to accommodate all the audience goers and the athletes. And during that time, there was a 23% reduction in traffic and an associated reduction in ozone levels. And during that time, when you look at the Medicare database, there was 44% reduction of asthma visits in children during that area. So for that 2 weeks, Atlanta experienced cleaner air. And as soon as the Olympics left, and of course there was other issues at the Olympics, but as soon as the Olympics were gone, air quality returned to normal. And why? Because of vehicular traffic and human activity. And along with that corollary, the asthma visits went back up again. So it takes very little, it's like a natural experiment. You couldn't design a better one to see that there's these associations. And so when I went to Atlanta, I thought, let me study the impacts of ozone because, a lot of times people do challenge studies in ozone chambers, and I actually didn't need one. Atlanta was an ozone chamber itself. And we studied people with asthma as well as non-asthmatics, and we found even in a small group of individuals, and oh, by the way, when I decided to study high ozone levels, that's when Atlanta didn't have high ozone days for those few years. But regardless of that, we still saw evidence of, at the blood level, at the airway level, that there was evidence of inflammation and irritation in the asthmatics, and was related to individuals' ability to counteract those that oxidant stress, in other words, that O3, which is ozone stress. So there are several other examples of natural experiments, including the Utah Valley Steel Mill study, which looked at particulate matters in the Utah Valley and saw that during a year of hiatus, there was a reduction in cardiac and pulmonary visits to the local hospitals. And again, when the labor dispute was resolved and steel mill went back to normal capacity, there was a difficulty with these chronic health problems again. So we went back to the Midwest, and we went back to Cleveland, and I thought, well, what am I going to study now? And little did I know, well, Cleveland also has an air pollution problem, and it has an air pollution problem due to the industry that was there before, and of course you mentioned the waterways, and also ozone. And I worked at the county hospital where, I recommend that to anyone in healthcare, that really it's doing really good work when you work at a county hospital. And we found that there was a significant strong signal when in months where there were higher levels of particle matter, there were actually more proportion of emergency room visits for asthma. Did I see that for pneumonia? No. Did I see that for long bone fractures? No. So clearly when there was an issue with air quality, there was lung disease issues. And so just as others have documented before, I came to appreciate that asthma metrics is essentially like having a canary in the coal mine. When others may not detect that there are issues with air quality that are affecting us in ways that we don't realize, asthmatics are canaries in the coal mine. But this is not new news, because in Cleveland, just as in other urban environments, health disparities are a real problem. And what are health disparities? These are issues where certain populations are affected more than others. One would think that air quality is the great equalizer, and to a certain extent it is. But those of us who are able to afford health care and afford medications, we are able to limit the effects that air quality and others' activities make on our disease. However, in certain populations you can't, and a lot of these populations are kids who are our future, kids who need to be able to go to school, kids who need to be concentrating in their homework and schoolwork instead of worrying about breathing and taking their medications and coughing and missing school. So there are real and disturbing health disparities that need to be affected. However, this is not just a pulmonary issue, as others have mentioned before, that there's a real biologic plausibility and an explanation that once you have airway inflammation or pulmonary inflammation, this actually translates to the rest of the body. You can have irritation in the rest of your body, you have damage to enzymes, and you have irritation of the blood vessels to the point where you see acute heart attacks and you see acute strokes. And so, people may not relate this to air quality because you're not breathing because by breathing air, you don't relate that to a problem in blood vessels, but it does occur. In fact, a women's health study has shown that there's an increase for every 10 microgram per cubic meter increase in particulate matter, that there's more mortality from cardiovascular effects. So I've come to respect that air quality is not just a pulmonary issue. And you mentioned the fact of cost, and how do we know that a implementation of a regulation actually makes a difference as far as cost? I'd like to illustrate an example of how there's downstream health effects and downstream collateral, not damage, but collateral good. And I've worked closely with our Cleveland school district, and through the SIPs, there's these opportunities for diesel school buses to get diesel particulate filters. And by doing so, you try and decrease the air pollution in the area. Well, guess what? There have been studies that have shown that inside buses, at the back of the bus, kids are exposed to 5 to 15 times as much pollution in the back of the bus as somebody in the car in front of them. So these are kids who are having growing and developing lungs, who are breathing basically tailpipe emissions. And by having these SIPs where people are actually improving the air quality by tailpipe emissions, by downstream effect and collateral good, you're having kids that are less exposed to air pollution. So the issue finally of the fact that this is not a visible issue is a real problem. And I would like to look for the silver lining, because that's a habit of mine. And the silver lining to this discussion and this debate in Congress is that this is an opportunity for us to bring to the forefront why we do this. And that is for our currency, our best currency, which is our humanity, our human population, and the brain power of America that makes us great. And that I basically am here to make the case that from the macroscopic to the microscopic level, from self to society, that there are no threshold for self-air pollution. And that is how I know that EPA does a good job of balancing the two facts, because if it were up to healthcare workers, we would want it much cleaner than any of the regulations would imply. So ultimately, it's our responsibility to ensure that canaries in our country and the world do not become silenced by inaction, while our country debates and refutes rigorous scientific evidence that will save them. Thank you.
Thank you. Thank you. Thank you. I think I'm going to go next to my neighbor across the Delaware River. And Mr. Rizzo, Ralph, would you give us your thoughts for a few minutes, please? Thanks. Ralph.
Sure. Thanks, Senator Carper. It is a challenge following such leaders in the field, both in the regulatory world, the legislative world, and the human health world, to add to what's already been said. So I hope that my comments are not viewed as repetitious, but perhaps further evidence of some of the points that have already been made. It would appear to me that since the passage of the Clean Air Act, we've been talking about it being a job killer and an anti-economic measure, and that debate unfortunately persists today. Let me just give you a little bit of background about PSEG and how I can make the case that the opposite is very much true. We are a company that's 107 years old. It's my responsibility to create or to reinforce the foundation that's already been built so that it lasts another 100 years. We invest in a variety of assets, some of which we hope run for 80 years. Our nuclear plants right now are licensed to operate for 60 years. There's been talk in the industry about maybe extending those another 20. We make investments in conventional power plants that we do discounted cash flow calculations, hoping that they will run for 40 years. So we have a very long time horizon whenever we make our investments. And the vision that our company has is to be recognized as a leader in providing safe, reliable, economic, and green energy. And we look at all four of those features as essential. And we're constantly trading one off of the other, and many times we're actually seeing one or the other reinforce a fellow characteristic. One of the ways we achieve that balance is through fuel diversity. So 50% of our electricity is produced by nuclear power. Nowadays, 35% is produced by natural gas. 15% is produced by coal. I know that just added to 100%, but a tiny fraction is produced by solar. If we were having this conversation a few years ago, the nuclear and solar numbers, the nuclear number would have been the same, the solar number would have been 0, and the coal and gas numbers would have been reversed. The exploration and extraction of shale gas has literally flipped the economics of coal and natural gas for us. Recently, we spent $1.3 billion improving the effluent stream of our coal plants to comply with the hazardous air pollution standards and the MAC standards. We created hundreds of construction jobs when doing so. The number varied during the 3-year period when we did the construction, so at the peak it was close to 1,000, other times it was fewer than that. And on an ongoing basis, we've added 50 jobs to the 3 plants that have this technology attached to the back. We've raised the cost of electricity by doing that, $7 per megawatt hour approximately. That translates to about 2.5% on a retail customer when those plants run. We are in a competitive marketplace. We're not rate-based regulated. So those plants only run when their cost is lower than the next competitive unit. Which leads me to my final thought as to why clarity and timing of regulation is so important to a company like ours. You see, back in the late 90s, we built 2 natural gas combined cycle units in the Midwest, thinking that the Clean Air Act amendments would be implemented by the year 2000, and we would have a competitive advantage with those plants. It never happened, and we had to sell them for 50 cents on a dollar. Now, fool me once, shame on me. I'm sorry, I almost got that right. Fool me once, shame on you. Fool me twice, shame on me. But here we go again. We've spent $1.3 billion getting prepared for the Clean Air Act amendments of 1990 and have very little tolerance for an industry saying, no, 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 we need more time and we need to wait. We've put our money to work. We're ready to compete, but it has to be on a level playing field on a fair basis, and others have to step up to that same plate. So there's much more to be said about carbon and others, but I know that we want to hear from everyone and give a chance for some question and answer, so I'll leave it at that.
Thank you, Ralph. Dan Greenbaum.
Thanks.
Welcome, Dan.
Thank you. I think it's not an accident that we're fortunate to have this session chaired by 2 senators who also have been governors, because I think that gives you a different perspective on the sort of what it means on the ground in some ways for these kinds of issues. And you're speaking about the visibility and the Smokies. It's not to say a congressman or senator doesn't see that, but I think governors are there every day in the state, and I think it's valuable to have you. And I really am honored to have the chance to be with you. I'm going to speak briefly about 2 things. One, some further thoughts on the health question, what we know about health because of the institute that I lead. And then secondly, my own role as a kind of bipartisan commissioner of environmental protection in the state of Massachusetts, because I was appointed by a Democrat and reappointed by a Republican. So the Health Effects Institute was set up actually in 1980, bringing together industry and government, EPA, to jointly fund an institute that could provide trusted science, science that could lead to cleaner air and better health, and do it in a way that people could have what was called at the time friendly facts, facts that you could understand and agree to on health effects. And over the last 30 years, we've done a lot of work, others have done a lot of work, and Dr. Khatri has summarized some of that and talked about some of that important work. I do think it's important to remember that every scientist is trained to answer a question with 3 more questions. So inevitably, there are always questions. Good science always says we need to do more research, and some would say that's just because they want to get more research money, but there are lots of reasons for that. It's good science to do that. But what we have seen over the last really 40 years, and certainly over the last 20 years since the very controversial changes in the air quality standards in 1997, we have seen a tremendous growth in our knowledge and understanding. Not just, we have more questions, we always have more questions, but a growth in our understanding. And as Dr. Khatri has pointed out, not just in the area of how air pollution can exacerbate asthma, but also in the area of how it can shorten the lives of people with pre-existing heart disease. We have very much stronger evidence on this. How it can shorten the lives and have effects on people who have pre-existing diabetes. Very strong evidence on this now. And this is not just, some people would argue it's statistical evidence, somebody's manipulated the statistics. We put, every study we do, we actually tear it apart literally before we publish it, and have biostatisticians tear it apart before we say we've accomplished anything. But we also have studies of putting volunteers in chambers and exposing them directly to the air pollutants. We have many different types of studies, and they all say there are both mechanisms that could be causing these effects and there's evidence of these effects. One of the challenges we have is that those effects are now showing up because our science has gotten better at lower and lower levels. And that is what's driving this discussion in a lot of ways about lower and lower standards. At the same time, those lower levels are less and less visible, and we've talked about that a little bit here. But I think that we know the science has gotten stronger in this area. Even as good scientists, we know there are more questions. Now, I wanted to shift gears a little bit and talk about an earlier era. My first day on the job as commissioner was May 1st, 1988. And I got to my office, and about a half an hour in, I was told by my staff we had to go up to Boston Common at noon to declare the first bad air day of the year. Well, it turned out that we had the whole Northeast had been lulled into the thinking that the clean air problem had gone away. The levels had been low. The summer climate had not been conducive to forming ozone smog, and for a number of years, Boston and many cities up and down the East Coast had not had a big problem. Not in 1988. We had a very terrible problem, much larger awareness of this, and in fact, that in some ways is what led to the support that led to the 1990 Clean Air Act amendment. You may recall that there were a couple of people running around the country in 1988 preparing to be elected president, and one of them was the guy who hired Bill Riley to run the EPA. But I think that that's something, we can't sit around waiting for another bad air summer, but we have to understand that just because we think the problem has gone away, it hasn't. I do want to speak about why it was that I was able to be reappointed by a Republican. One of the things that I understood very early on was that while the Clean Air Act has worked very well, I chaired a National Academy Committee on this a few years ago, that doesn't mean every rule is perfect by any means. And there's lots of room for smarter rules and smarter ways of doing things. And EPA itself has done some revisiting of rules and improving of rules along the way, and they have the flexibility to do that to some extent. I think that the Act does allow them to do that. But the key thing in my mind is to do two things. One is to set clear standards, that level playing field that Ralph Izzo was talking about, and then let the marketplace come up with the most creative, most cost-effective solutions to it. That's been a key. Where the Act is clean, whether it was the cheaper and cheaper ways to do catalysts on cars because the standards were set, whether it was setting a clear standard for cap and trade of sulfur dioxide, which meant that when I left being commissioner, I was given a ton of sulfur dioxide, which then was only costing $120 a ton, because that's how much it had ended up costing to reduce a ton of sulfur dioxide. But in each case, setting those clear rules and revisiting the Act. I'll close just with an example of how the Act as it works today can self-correct. One of my accomplishments as commissioner was to put those hoses on gas stations in Massachusetts that captured the vapor. And if you had been there before and after, you could smell the benzene. It was really bad. So we did that. That was in 1990, I think, and it dramatically improved the air. The people working at the gas stations clearly benefited from that less exposure. Well, last year, EPA announced that it's planning to revisit that rule and undo that rule. And why are they doing that? Well, new technologies have come forward. Most of the vehicles out there today have onboard vapor recovery. You don't need to have that hose anymore. And the Act gives them the ability to come back and say, well, all right, that served its purpose. We've got all the new cars. Let's get rid of the old rule and reduce that cost for the gas station owners, et cetera. So there's flexibility within the Act also to be innovative if the rules are clear and the technology is allowed to develop in the private sector. I'll stop there.
Thanks. Been great to see you. Thank you for joining us and for your input. The three of the people who, I might be wrong on this, but I think three of the people in the Senate who worked as much as anybody on our side of the hill on clean air issues in the last 10, 12 years are you, Senator Alexander, George Voinovich, former governor, Senator from Ohio, and maybe me. maybe me. Ironically, like, we're all former governors. And believe it or not, we're all former chairman of the NGA, National Governors Association. As Lamar knows, one of the ways that the governors make policy, NGA makes policies, you got to get 50 governors to agree on something. And anybody can basically scuttle it. You got to get unanimous consent. And so one of the things that we did in our time as governors was learn how to develop consensus, to build consensus. Something that serves us well even to this day. It wasn't hard to develop consensus in 1969 that something was wrong when they had 65 bad air days in San Francisco. It wasn't hard to convince people we had to do something differently in where you hang your hat now in Cleveland when a river caught on fire, that we need to do something about quality of our water. That was pretty easy. And as I said earlier, the cost-benefit ratio, we're told, flowing from the Clean Air Act is about $30 in benefits for about every dollar in cost. It was a little bit like shooting fish in a barrel, though. It didn't cost a heck of a lot to get a lot better result. People can swim, I think, in the Cuyahoga. You can fish in the Cuyahoga. You can eat the fish there. Last time I was out in the Bay Area a couple of months ago, I went running and felt great. Didn't worry about it at all. Hadn't worried about it for years there. The Delaware River that flows between our state and Ralph State, sturgeon coming back. People actually can swim in the river and sometimes do. Pretty remarkable, but it's no longer, if you're going to go out and try to do more to clean up the air, we don't get $30 in benefit for every dollar that we'd spend. It's arguably a lot less. And these regulations that are out there and the legislation that Senator Alexander and I and Senator Voinovich and I worked on, you don't get that kind of payback. But there is a payback. There is a return on investment. And there's an entity in OMB, the acronym is OIRA. The guy that runs it now is a fellow named Cass Sunstein, who actually has a pretty good reputation for being able to look at regulations and to try to figure out how do we get a cost-benefit ratio out of that, so that when we're looking at these different issues, we know there's some good science at work. And it's not just feel good, back of the envelope. There's actually good science at work. Could you all talk about, our panel, could you all talk about how that might help us as we try to develop some consensus in the Senate and maybe somebody in the House around these clean air issues? That we could actually say, look, this is not just something we want to do to feel good. Oh, we do want to feel good, and we want to feel better, we want to be healthier, but actually there's good science here, and somebody's actually scrubbed this again and again and again to come up with that cost-benefit ratio. Can somebody take that for me? In fact, several of you.
Tom, can I just amend your question? I mean, take the specific example of the ambient air quality standards that Cass Sunstein pulled back, which we'll have to revisit in 2 years. Several of you have mentioned that. And those are health-based standards, right? And if I'm not mistaken, it's illegal to take cost into consideration when the EPA sets those standards. Is that not correct?
Yes.
And if that is correct, is that right? I mean, we're now to a point where communities all over the country that have done the things they can do in their community, and utilities have done some things. So take Tom's question, but it gets confusing because EPA does a cost-benefit ratio, but then it's illegal in that case to consider it.
Well, the way that those regulations are reconsidered is the so-called CASAC committee, the Committee of Scientists, Science Advisory Committee, opines on the adequacy of the standards to protect health.
Right.
And it is thought that that is a number that is reached with respect to ozone, for example, that should be sacrosanct. It should be real, irrespective of what the cost may be to achieve it. The reality is a state implementation plan will have many choices in how to achieve a reduction, and it will be very carefully attentive to the economic impact of a particular reduction once it's made. And the truth is, if you are making a decision like that, there is no way you are oblivious to the cost burden you are going to place on the country when you make a new standard. And I'll give you a good example. 1 year after the Clean Air Act had passed, CASAC recommended a new ozone standard to me. And I didn't accept it. The administrator doesn't have to accept it. It's probably the only time I ever did not accept a scientific recommendation that was made to me. I didn't accept it because it would have thrown about a third of the country into non-attainment. And we had just passed a Clean Air Act the year before, which already required enormous adaptation, cost, disruption to plans. So, and because I also knew that it would come around again in 2 years, as it does, just as the administrator acknowledged and the president acknowledged with respect to the CASAC recommendation that the administrator did not accept most recently. So, you know, you are supposed to set a standard, and the standard does tend to acquire, even if administrator does not accept it, has to give a reason why he doesn't accept it. It does stand. It will become the law. It's probably an effective way of deferring that exception that an administrator can take to it. That's one of the very few areas, however, where there is no cost analysis at all that's applicable to the precise delineation of the number itself. And in my view, it's not particularly meaningful. It shouldn't be held up as a reason to distrust the whole clean air regulatory process.
Anybody else on these priorities? Go ahead, Dan.
Yeah, if I might. I actually appeared, Senator, before you and Senator Voinovich several years ago at the time of the previous consideration of the particulate matter National Ambient Air Quality Standards at one of your listenings. Not your hearings, but at one of your listenings. And actually, Senator Voinovich and you were both listening to the testimony. And one of the things I said is that in essence, well, the way the Act is structured now is that for the setting of this goal, how far do we think we need to go for ozone or particulate matter or any of these, the administrator is asked to make what I called a public health policy judgment. It's not just a pure public health judgment. It's not a pure, this is exactly what the science says, but it's some weighing of the uncertainty. There's always uncertainty in the science, again, and what we definitely know versus what we don't know, and how far do we think we can go before we think the uncertainty gets too big to bring on the impacts of this, the extra non-attainment areas, the various other things. The reality is that I think in many cases those decisions have been made in ways that weren't purely whatever the science might have dictated, although the best chairs of CASAC have regularly said, we shouldn't be making this decision, it's the administrator. So in the case in 1997 with particulate matter, the agency proposed a standard for particulate matter daily levels of 50. By the time it got done, it was actually 65. It was higher than the proposal. This was in the Clinton administration. Obviously, in the Bush administration, the most recent Bush administration, there were some examples where there were suggestions that it should be tighter, and they tightened, for example, the ozone standard, but not by as much. And there are a variety of these. But, so these public health policy judgments, I'm sort of are not. You can't legally say, well, I'm doing this. In fact, I was a little surprised by Cass Sunstein's statement, because for him to say we're pulling back this standard because of the costs would almost get them into trouble for doing that. But I think that does play a role. More importantly, it's almost impossible to know what the full costs of implementing a standard are going to be at the time you set it. It isn't really necessarily the time to make that judgment. I mean, in some terms it is, but because in reality, the decisions that will be made about whether or not we would control utility emissions, vehicle emissions, steel plant emissions, or whatever it is we're going after, are going to be made in a much more detailed fashion, either by the agency for a nationwide rule, or by the states or by groups of states like the Ozone Transport Commission in the Northeast. And in those decisions, cost is absolutely a factor. You are usually required to do some analysis, and it can be brought into which is the most cost-effective way to get the reduction. So in some ways, the structure now, although no structure is ever perfect, uses this broader public health policy judgment to set the goal, and then uses much more refined analysis as we get into it to figure out what's the most cost-effective way. And part of the problem, I said this earlier, once, and this is what Bill Riley said too, once we've set a rule, almost always, in almost every case, the actual costs of implementing have been lower than even the agency thought they were going to be, let alone much lower than what some in the industry had said they were going to be. But it's hard, so it's a little hard to do it. But
I don't know that Mr. Sunstein said cost. I mean, maybe you do, I don't.
Yeah, I didn't, I thought
You may have.
I may have
but
been.
I don't know that you
No,
did.
I may have been guilty of reading a press report of that and not going back and reading his announcement. But I understood what he was doing. In some ways, he was exercising that same, they were exercising that same public health policy judgment. Well, we'll wait a couple of years and we'll make this judgment then. I'll leave it to the courts to figure out all the rest of it. I'm not aware.
Ralph, please.
If I may draw an analogy in terms of answering the question, utilities and power generation companies tend to have a high concentration of engineers, very analytical, quantitative people. So we run our 40-year discounted cash flow calculations on our power plants, and if that net present value is any number greater than zero, the theory tells us build the plant. And we measure safety incidents and air emissions and dollars per foot of pipe installed, dollars per foot of cable installed. And I caution my management team always, if you come to me with a spreadsheet that says, here is the answer, I can easily replace your salary with a 15-year-old who knows when 10 is greater than 9 or 8 is less than 9. And that there is no substitute in the analysis for judgment. That changing the assumptions completely changes the outcome of the calculation when you're making projections into the future in particular. Clearly, the analysis has to inform the discussion, and policy decisions should arise from that. But to think that the cost-benefit number really is solidly known, I think, is a mistake, just as our investment decisions can be predicted with 100% precision. My preference is to simply have a policy discussion about what are our values and what matters to us. And are there technologies available or easily within reach that can set a standard? To then pick that standard, and as Dan mentioned before, then to allow innovation and others decide if there are even better ways to do better than that. That will raise costs of electricity. That will create some economic shifts. That will put some industries that can barely afford to pay their electric bill perhaps under. It will give rise to other industries, industries that manufacture and create the technologies that are used to clean up the air and the water, and so forth.
Let me, Lamar, I think Lamar's got some questions to ask, and I want to hear his questions. So let's just move on, and we come back and touch on some of this again. But go ahead. But Lauren, in yielding to you, let me just make one observation. You know, in terms of actually getting things done here in the Congress, in 1969, you had these 65 bad air days. It wasn't hard to convince people that something was wrong. In Ohio and Cuyahoga River in flames, it wasn't hard to convince people that something was wrong. And we weren't coming in out of the worst recession since the Great Depression either. And the argument that, you know, we do something to help the Cuyahoga or clean up the air in the Bay Area, you know, didn't have to argue that it's going to do something to the economy, at least not like we have as a concern now, even though we're coming out of the recession, I think, pretty well now, finally. Okay, with that having been said, Lamar, my friend.
Well, thanks, Tom. Let me I hear what you're saying about, I mean, what you really said, what I heard was, even though the Supreme Court has said you can't consider cost on the health standards, that's what they've said the law is, you're saying actually that's what happens. Although Tom and I have been to many hearings where EPA administrators have had their heads beaten in by senators who've made them say, you can't consider cost, can you, when you're dealing with ozone and the ambient air quality standards. Let me ask this question. We're kind of pondering how we got to the point where this unanimous support. I think it's hard for people to realize who weren't around the 1970s how suddenly the environmental movement came on the country. It was like the hula hoop. I mean, it just, I mean, here it came, and everybody, I mean, Earth Day just sprung up, and everything happened. It just was a great gathering, and out of all that came the response that the Congress and the President made to that. And I'm sure that it's true that the fact that in many places in the country you don't see pollution. We do in our area. I mean, the Great Smokies is the most polluted national park. We have health problems in that area. And I'm sure there are other parts of the country like that. But as I've watched the Congress over the last few years, and I've wondered why Tom and I can't get any further with our what we call our 3P bill. You know, I mean, we've even said, okay, let's put carbon over here. He doesn't really want to say that very much, but sometimes we've said that. Let's just take sulfur, nitrogen, and mercury and do it. But we can't get that done. I mean, we tried that when we had a different composition of the Congress, and we've introduced it again, and we've gotten up to 15 or 16 co-sponsors. And maybe you can, and I think here's kind of what happens. On the one side, we get people who've spent $1.3 billion in investments. TVA's done the same in its area with coal. I mean, it's prepared for this, saying, look, why should we wait any longer? We want a level playing field. We've spent our money. Why should utilities in other parts of the country be different? And we get the environmental groups saying, we don't want any more delay. And we get the health groups saying, we don't want any more delay. If you're sick, you're sick. And so you're saying, in practicality, our best chance to get a strong rule is to wait for a good EPA administrator, maybe appointed by Democrats, who will go ahead and do something that needed to be done a long time ago. On the other hand, there's some who say, some industries who might say, we're going to hold things up and delay things in the courts. So it's in nobody's interest really to get a law. I mean, either the people who don't want to do anything say it's in our interest to throw it into the courts, and the people who do want to do something say it's in our interest to throw it into the hands of the EPA, and so we end up without a law. And the competing groups work within the Congress to do the reverse of what happened in the 1970s and even the 1990, 1991. My view is everybody'd be better off. For example, let's just take the Boiler Act rule, and I'll stop and I'll ask you to comment on this. My understanding is that it's very difficult for the EPA to write a good rule for boilers that has to do with the maximum achievable technology under the current law. It just doesn't have the authority to create the methodology that makes common sense. And most people I've talked with who have boilers say that 5 years instead of 3 years would make a massive difference in cost. That's what they say to me. So it seems to me the perfectly obvious answer to that, and there are, I think, 43 senators who agree with this, why don't we just pass a law saying you got 5 years, and this is the standard. We're not going to lower the standard one bit. I felt the same way about the cross-state law. I thought, the standard's been around since the Bush days, 2005 and 6, the cross-state air pollution law. We don't want dirty air blowing from Kentucky into Tennessee, but if we can get it fixed in 2 years by passing a law instead of 1 year, by fighting in courts or not passing anything on an EPA regulation, I'd rather go another year. So what about as we get to these more, what can we do to create an environment in which Congress can actually succeed in giving you the certainty that you talked about and the level playing field you talked about, even though it might mean that you get disadvantaged a little while because you've spent your $1.3 billion and other utilities didn't?
So, Senator, I don't have an answer because we were supporters of both 3P and 4P and would like to see that happen and didn't. We would be more than happy waiting an extra year if it meant clarity. We signed on to an Edison Electric Institute compromise proposal that asked for not 3-year implementation of the HAPS-MACT rule, but a 3+1 year implementation, not because we wanted to give people a 4th year, but because we thought we were able to get our colleagues in the industry to agree to not litigate.
This is utility.
This was utility MACT. So I don't have an answer for you, actually. I would trade off a certainty for delay anytime. If people really would sign up and it meant waiting another year or two, I'd be happy to help you make that case.
Some of it depends on what you're trying to do with the extra year. Are you trying to force technology through that, or trying to help technology develop over the extra year? Are you trying to reduce the cost because they have more time to put the standard in place or put the technology in place? One of the things that's happened under the Clean Air Act is that when we passed the law to begin with, it was the standard that was set for the automobile industry was meant to force technology. And for all intents and purposes, it worked. The catalyst was already under development, but it became a requirement on the part of new automobile engines produced after 1975 or 1976, and it had an enormous beneficial effect on reducing emissions from the automobile. One of the problems with that is, in my judgment, is because it worked with the automobile, there was a sense that let's do that for everything. Let's try to force technology for all kinds of things by passing deadlines beyond where the technology currently would go and mandating certain levels of improvement. And it doesn't work for everything. There are some industrial segments in which it simply doesn't make sense to try to do that. So you have to tailor each requirement in the law to make sure that it's rational and applicable to the industry that you're trying to affect, so that they have the time. And there were consequences, particularly in the first version of the Clean Air Act, if you didn't meet the deadline. And that gave people additional impetus to try to make sure that they did everything possible to meet the deadline. In fact, the deadlines and the forcing of technology came because Senator Muskie, who was then the chairman of the committee, became convinced that the automobile industry simply wasn't going to do anything unless he set deadlines and tried to force technology through the deadline. He believed this because he had come to an agreement with them several years before that they were going to make progress on improving the engine emissions, and he didn't believe they were living up to their agreement and made any progress. And so that's where that provision came from. But if you just extend the deadline and there are no consequences for meeting it, for not meeting it, it may not work. You may just run into another deadline request and the next one looms.
Yes, thank you. And I think from the healthcare perspective, one always is worried that there would be a loss of momentum. I'm really not sure about the inner workings of how Congress works and how things are delayed and why isn't it just a law, and why is it refuted in court. But we have ample evidence now, and now with the idea that science is studying, nature and nurture, gene and environment, the wealth of our knowledge is increasing from the time of the 1970s. We've got animal models that show that these are real plausible scientific associations. And I think, the healthcare industry is concerned about rising costs and just worried about you can't just throw medications at things. You have to try and think of a global solution. And, not just thinking without the impact of economic issues. You have to have healthy people to perform their jobs too. So I would just like to propose that we kind of go back to a era of real scientific and respectful discourse. I think would be very, very helpful. That's just my opinion. No, not just mine. I think many others in healthcare would agree. Never mind.
Dan?
Yeah, I just one comment. I think I remember having recently been commissioner when the House and Senate changed over in 1994, and I actually thought at the time, gee, maybe this is an opportunity to see there was a Democratic president and a Republican Congress to make some progressive thinking changes in regulation. Because I'd seen the inside as a commissioner, and in a progressive state that was quite aggressive for what it did. But I'd seen a lot of places where there could be improvements made, whether it was timelines or various other things. And one of the things that most disappointed me on the House side in that changeover was how rapidly that House tried to push the pendulum too far and too fast. In fact, I think I heard Bill Ruckelshaus talk about his caution to his colleagues on the Republican side of the aisle to not push the pendulum too far and too fast. And as a result,
it didn't work.
It didn't. Well, right. But one of the things that I think has happened is that the culture here is a culture of everybody plays defense. Nobody is sure about who's who in these different places. And so EPA is going to be much more aggressive in what it tries to do because it knows it might get pushed back to go less, but it can't give that ground easily. I think, certainly people like yourself and Senator Carper offer a place where real conversation can occur, but that's not the perception of the vast majority of even the members of the Senate right now. And so I think, and I'm not just saying that's on the EPA and the Democratic side, et cetera. I think it also happens on the business side, that there's this, well, we're going to play this hardball because it's so uncertain. And then, of course, right now we have this, your colleagues on the other side of the Capitol have a more interesting approach to this, and a far or somewhat more limited approach, but they are more complicated to work with. So there's this fear that, you know, well, if we give a little ground here, then it's going to go over there, and then it's going to go further, et cetera. And that makes for the worst policy judgments. I'm sharing with you. I mean, I think it's not a good culture to do that. I think one way to, you know, discussions like this, discussions that are facilitated to build some bipartisan interest in discussing these issues can make a difference. And I think we saw some of that from different groups trying to do that around the debt ceiling and various other things. And maybe could get back to the climate in which this can happen. I mentioned before, I was actually invited by both Senators Carper and Senator Voinovich to testify. This was when Senator Voinovich was chair of the Air Quality Committee on these very contentious rules, but because he was cognizant of what the issues were about, he had been the governor of a state, he'd been the mayor of Cleveland, as well as...
As every other elected position in Ohio, Voinovich held them all,
Yeah.
from county auditor, you name it.
But I'm not sure. I think part of the problem is that there's been fewer and fewer people with whom they have that conversation, and that just creates this gridlock.
You know, I would just add, the one consequence of where we are, and I agree, very interesting to hear Mr. Izzo say how much he would value certainty. He would defer a lot to something that even 5 years away he would like to get now in return for knowing he's really going to get it in 5 years. One consequence of the current reality is that the debate, although Congress, in particular the House, is very noisy about things environmental, Congress doesn't matter to most of these debates anymore. It's all EPA and the courts. It's really, that's been the consequence of the stalemate. And if that mattered to people in the Congress who really wanted to have a role again and be constructive and recognize that some of these statutes need revisiting in some pretty fundamental ways. We usually revisit the Clean Air Act every 20 years or so, and we're not. It's been how many years, since '78, I think, since we revisited the Clean Water Act. I remember Senator Chafee told me, you don't even think about bringing up a new Clean Water Act. Everybody's exhausted, and a lot of people are angry after the clean air debates of 90. But Congress has taken itself out as a result of this extreme ideological divide that now exists and the implacable opposition to regulation in the House. If that were better understood and leadership could say, well, we'd like to have some influence and we're not having very much at all, it might make some difference. But nobody, I think, who wants to see constructive changes and revisiting of some of these statutes would dare touch that or propose it in the current climate.
Let me ask one more, if I could. Sometimes I try to think, how do we get this movement? How do we get this revolt? How do we find common ground? Hunger, I know Lamar does. George Voinovich did. Hunger to get things done, make progress, find common ground, and find the middle. Use some common sense. Sometimes what happens, you got the folks on our side in an effort to be able to strengthen our base, appeal to our base, respond to our base. We will focus on cleaner environment, lower emissions, lower emissions. On the other side, our Republican colleagues think that, well, we'll just focus on, not on lower emissions, better health and that sort of thing, but we'll focus on job creation, strengthening the economy. I've always said that we can strengthen the economy by lowering emissions. And there's any number of opportunities. I remember when Lamar and I first started to think about mercury emissions and figuring out, can we reduce mercury emissions by even 80%? And George Voinovich and I held a hearing, and there was like 5 people on the panel. 4 out of the 5 said, no way we can do that. And one person on the panel, I think he actually came from the industry where they manufactured technology to reduce emissions. He said, oh, we can do that. We can get to 80%. Routinely, and Lamar pushed me actually to make reductions in mercury in our 3P bill. Actually, we got to 90% reduction. And commonly across the country today, it's 90%. It's 90%. And we create a lot of jobs, American jobs, by implementing that technology and installing that technology. Give us some advice, if you will, and I'll just, this will be my last question, but give us some advice on how we can better tell the story that we can actually create a bunch of jobs. Like someone mentioned diesel emission reduction. I don't know who mentioned diesel emission reduction. Actually, the Voinovich Carper thing with Lamar and I were working together. We actually create all kinds of American jobs and reduce their diesel emissions. I think you had mentioned that. But how can we better tell that story? That there's a connection, not a disconnect, between the cleaner, lower emissions, cleaner air, or cleaner water, and the creation of American jobs. How can we do that better? Anybody?
We did, in fact, create a new industry as a consequence of the Clean Air Act. We really did. I mean, we saw a whole range of new technologies that were invented, beginning with the auto industry, to try to, and in the oil and gas industry, for sulfur reduction, for NOx reduction, for SO2, for monitoring, for IT kinds of controls on things that were very sophisticated, and there are many of those now that are now beginning to be applied to water for the first time, which we're all of a sudden seeing as a resource that needs to be managed much more, husbanded much more carefully, for whether it's for irrigation or simply security and integrity of pipes. That industry never has functioned as a coherent whole in representing its achievements, the number of people who work in it, to the Congress, because it's so disparate and diffuse, and it's in all sorts of places. But it really is there, and a lot of those businesses are reasonably small. That's one thing. I know I've served for a long time on a company who's a company you know very well, DuPont, which has basically bet the store on a whole range of very low footprint technologies, low materials resources that are tended to provide more safety and fire protection and all range of things, and basically reduce their CO2 by 69% since 1990. That can be done, and they've saved more than $3 billion of energy cost in the process. Those stories, I think, are all over, and remember the budget director in our administration, the first Bush administration, predicted a recession as a consequence of the passage of the Clean Air Act of 1990. Well, we had probably the best 10 years in modern American economic history following that Clean Air Act. And I don't think it certainly wasn't the driving factor, but it was certainly not an inhibiting factor.
You know, the studies I've seen on the economic studies on job creation, the serious ones, not an advocacy study on one side or the other, indicate to me at least you've got to be careful about this argument, because there's a slight benefit on an overall sort of cycles scale of job creation by regulation and environmental pollution reduction. But the kinds of jobs are different, and some of the jobs that are immediately impacted, assuming a plant of some kind shuts down as a result of a regulation, are here and now. Those are people who have the jobs who no longer have them. And a lot of the jobs that you create as a regulation begins to take hold are new jobs. They're not, people don't hold them now, so they're not out there advocating on behalf of that particular technology or approach. And I mean, I think the way we need to think about what kind of regulatory system we want is if we're willing to pay more in whatever form for cleaner air or cleaner water or a healthier environment, because we believe, as I do, that overall the economy is going to be healthier if your environment is healthier. It's hard case to make with statistically, but I believe it's true. But if we Americans are willing to pay more in order to get more in terms of public health and the environment, then we should simply pay more. And who pays for it are essentially two groups. It's either the taxpayer or the consumer. And neither one of those, they want the cleaner air and cleaner water, but when it comes right down to paying for it, if it's visible on their rate system, sometimes they don't like it as much. But it seems to me that's something we need to argue, that it is more important to us. It clearly is more important to us in certain times of the year. It's more important when there's no financial stress or fiscal stress the way there is now. And the support for it shoots straight up once you're in better economic conditions. So, I mean, I think it's hard to legislate in this area. It may be important to try to make sure you've got the proper balance somewhere in the system between health improvements and cost, for instance. Exactly where you put it and at what time you impose it is an important question, but it's not immediately obvious that it's better in one place than another.
Thank you. Senator Alexander is going to have to slip out in just a few minutes. He told me when we're just getting underway that he needed to walk out the door at about 4:40. So, Senator Alexander Lamar, a final thought. It can be a question, but just a final thought.
No, I just, I made a lot of notes, and I appreciate, this is quite a group for me to hear. It represents a lot of experience over time, and I hope Tom and I can work together on this. I mean, I think Congress ought to step up to our responsibility, which is to deal with clean air laws. You know, I don't like turning over. You know, a good Republican position is, why should we turn over too much to bureaucrats? You know, we should be making our own decisions. So I think we've not done what we should do. I think there should be a bipartisan group, not just to be bipartisan, but to get a result. And I think maybe the way to do it is to take pieces of it, one at a time. The Boiler Act might be a good area to see if we could get some reasonable certainty. I mean, if we knew that that would happen, in our state, the estimates are that it's a $530 million cost. I mean, I've talked to a lot of people about it. They're willing to do it, and they're willing to, but they, I think, rather spread it over 5 years. And if you're making big transformations with your coal plants, like you did, TVA's doing, you can't have everybody in the country run around buying $300 and $400 million scrubbers at once. I mean, maybe it makes some sense to pass a law and say, look, we're going to do this. You don't need to go to court about it, because we're going to do it. Now you've got 2, 3, 4, 5 years to do it, but this is the standard, this is the certainty, it's going to happen. I think tactically, from the health point of view, we're more likely to get a result within a shorter period of time if we actually pass a law and that we could agree on. So I welcome this discussion. I thank you for inviting me. Excuse me for leaving.
Well, my thanks for being a part of this discussion today, and God knows for your leadership in the last 6, 7 years on this. I think whenever I chair a hearing, either in our Clean Air Committee or subcommittee or over in our subcommittee on federal financial management, one of the most constructive things that we do in every hearing is I go back and I ask the folks who have been witnesses to give, they give opening statements, they respond to questions, but I always like to go back to them and say, given what we've talked about here, some discussion that we've had, how about giving us a benediction and then a blessing? And I'm going to ask each of you to take like a minute or two. And we've had not as long a discussion, frankly, as I'd like, but a good one, healthy one. And I'm just going to start with Dan, if I could, just to kind of reflect, think back on this discussion here, and God knows how many others you had that pertain to this, and just give us some thoughts going forward.
Well, thank you for that opportunity, and thanks for the chance to be here. I think I'll try to be very brief and just say 2 things. I think one is that we know a lot more than we did 10 years ago, 15 years ago, 20 years ago, and one of our biggest challenges is that what we know about air pollution is it has effects at lower levels than we used to think it did, which means it's even more invisible. Fine particles, you can't really see them. Those old big plumes of particles coming out of old diesels without the filters, we knew that it was there and it was a problem. But the science has gotten stronger. It doesn't mean we shouldn't stop doing the science, and we should continue to answer questions, because there still are. We can refine it. Which sources may be most toxic? Are there differences there? We're looking at that. But I think that's one. The second is just the comment I made at the outset, and I'll come back to it, which is I think we, as a country, as EPA, as an agency, do our best when clear standards can be set, a level playing field can be clearly articulated. I do think the Senator Alexander made a point, and held to, i.e. not through years and years of court suits, and then let the private sector respond. Because once that is out there and people put their R&D at work and various other things, they all have an incentive to be cheaper. The best example I can think of is when California and then the federal government went to tighter standards for car emissions. The first thought was it was having to do with the cold start. It was going to be too expensive. We'd have to put heaters on the catalysts, and there were going to be all these problems. Well, a couple of companies and smaller companies said, well, what if we made a heat-resistant catalyst that we could install closer to the engine, so it would heat up faster? We can do that for a slight extra cost, but nowhere near as much as what people thought. In fact, that became the technology. But the rule was set. You need to meet these cold start standards, and then the technology was able to be developed. And I think if that can be true across the board, the clarity, and I think the clarity of timing is really important. I do think there are times when, you know, the sulfur dioxide trading was established in the Act. It was very clear it was going to happen into a certain timetable, and it happened pretty much according to that timetable. And there weren't lots of court suits about it because it had been set up. But even without that, I think that clarity is really key.
Ralph?
So just 4 quick points. We keep talking about the connection between environment and the economy. In terms of job creation, you can use us as a data point. I'm sure there are others. Putting these environmental pollution controls on create jobs in the short term. Construction jobs, operating jobs subsequent to that. Secondly, in the long term, clarity provides for economic efficiency in forms of resource allocation decisions that are intelligent. I don't want to put an SCR on a power plant today if 5 years from now it's going to be dead because of its mercury and sulfur emissions. So importance of clarity can't be overemphasized in terms of resource allocation decisions. Thirdly, we shouldn't be afraid about the fact that this will cost more. And sometimes that makes perfect sense. You're going to be imposing constraints on industries that have adverse consequences on the environment, and you're going to be growing industries that help nurture and create more sustainable economic enterprises.
Sumita, Dr. Khatri.
Yes, thank you. I would like to throw the medical community's support into these efforts to increase the awareness of air quality and health issues. I think that's an area in which we practitioners can do a better job. And I also think that we need to do better research from the epidemiologic standpoint now that there's more electronic medical record systems, and work with EPA to see what types of air pollution have the more associations with different types of health effects. That may be helpful in the formation of future public policy. You have our support.
All right, thank you. Administrator Riley?
I think the environment is only one of these divisive, hot-button issues that currently we're contending with. In many ways, it strikes me it ought to be the most straightforward. It ought to be an easier one. The reason we've been so successful, really, in addressing environmental problems is because of the extraordinary bipartisan support that the initiatives have really had up until the mid-1990s. That was a characteristic of our progress and an underlying cause of it. I really do think now that if we can't address mercury and some of these more obvious pernicious threats, addressing what really strikes me as the most dangerous one lurking out there in the future, climate change, is going to be really impossible. The Congress really should be leading the country on preparing the country for that inevitable consequence of climate change. And some cities are way ahead of the national government, like Chicago, New York, Seattle. I chaired the Governor Schwarzenegger's Commission on Adaptation in California. It's extraordinary, the consequence of a 1-degree change in the number and size of forest fires anticipated there. And you know, these things cascade when you look at them. We are sleepwalking through that, and it strikes me it's almost like the British quiescence says the Germans rearmed in the 1930s. It's coming, and it's inevitable, and the longer we wait, the more serious it's going to be, both in terms of adaptation and in terms of mitigation, which we have not even really begun as a country. So I would think that the kind of leadership that you're evidencing here, I think it is hugely important, and example you're setting for how to address some of these issues in a very deliberate and straightforward way, without the epithets and without the paranoia. That's got to be replicated. I mean, among a lot of your peers in the Congress, even the Oil Spill Commission, I discovered you couldn't be on the President's Oil Spill Commission without generating all of the concerns about the President that should have been irrelevant to the resolution of getting good, safe practices in the Gulf. That really has to change, and maybe after the election there's a chance to regroup. I think in some ways there's evidence that the country would like to see a change in the attitude and the temperament and the way these issues are addressed. So more power to you for going down that path, and I would hope to be helpful to you if we can in any way.
Well, you've been helpful today. All of you have been. Thank you for that offer. Thanks. Minister Ruckelshaus.
Senator, let me try to suggest a way of the Congress, even under the current conditions of sort of hyper-partisanship in some cases, getting at some of the issues in the Clean Air Act. I was part of 2 Republican administrations in which they were very reluctant at the end of the Nixon administration, in the first term. And then in the Reagan administration, they were both reluctant to suggest amendments to laws to the Congress in the environmental area, because they were afraid that the Congress would take them. The Congress was then divided. There was not totally Democrats or Republicans, but they're split between the 2 houses. They were afraid that they would take them and move them to such an extreme that would make it impossible to sign them, or the President would have to sign something that was so different from what he had additionally suggested that he wouldn't like it, and he would be accused of vetoing his own law. So what they did was simply duck. They didn't send anything up to the Congress. In fact, when I left the Reagan administration, that was one of the principal reasons I left. I didn't see any appetite. It was also true of the Congress. There was no appetite to receive recommendations from the administration. Well, if you were to take the Clean Air Act and adopt Senator Alexander's suggestion that you use an incremental approach, you don't try to amend the whole thing at once, and look at sections that need to be changed, or maybe even one section, convene, have open hearings in which you try to establish a set of principles that you're going to try to achieve, or goals you're going to try to achieve while you're reviewing the law itself. And then once you've got a sort of an agreement on the part of your committee of what those goals ought to be, or what that approach ought to be, then you convene using collaborative processes, all of the people that are going to be impacted by the changes. You've got to get them all at the table, or it won't work. They won't. But if you got them all there and asked them, said you're going to act, that motivational decision, statement would have to be made by you. But you want their support. You want them to understand what the changes they're all going to recommend. You expect them all to support whatever agreement comes out of that effort. And instead of trying to come up with a law itself and then present it, I know it's not that simple, but present it to the people who are going to be affected, and they almost immediately rise up and say, we don't like what it is you've done. Get them involved much earlier in the process and get them to agree to it. Whatever comes out of the process itself, it seems to me you've got a better chance then of getting a concerted set of agreements that will carry forth to achieve the goals and principles that you've established. I can't think of any other way to do it. That's the reason I suggest that.
All right. Just a couple of quick things, then we're going to open it up to questions from the press. I think mostly who were gathered on the front row. My dad used to say to my sister and me, we have a job to do. We didn't do it very well at home as we were kids growing up, and he would say to us, "The job's worth doing. It's worth doing well." He had been an old chief petty officer in the Navy. He didn't say it. He was tough as nails. He didn't say it that nicely, but he sure said it a lot. He also said, "Just use a little common sense." He said that a lot too. And you probably all remember things that your parents said to you growing up that have helped guide you in your life. For me, those are a couple of really guiding lights. My mom used to drag my sister and me to church right across the street from our house in Southern Virginia. And we went there a lot. She wanted to make sure we'd figure out the right thing to do and do it. She wanted to make sure that we would really internalize the golden rule, treat other people the way that, that we want to be treated. And those are some of the, for me, the guiding principles. If we went around the room, probably everybody has principles like that you learned as a kid growing up or someplace along the line. We have made extraordinary progress in this country with respect to the quality of our air. Is it perfect? No, it's not perfect. Is it better? It sure as heck is. Can we do better still? Yes, we can. And the question is, how do we do that in a way that, if you will, not only is respectful of health, better health, but also is not oblivious to a cost and a cost-benefit ratio. And I'm encouraged that from this discussion today that we don't have to choose one or the other any more than we have to choose the issue of better health, better environment, and frankly a strong economy. They're not just mutually exclusive. I keep going back to how could they come up in 1970 with unanimous support for legislation. I could introduce a bill today that say today is my 65th birthday, which it is, and which I could introduce a resolution to say that. I probably couldn't get 60 votes for that in the Senate on that kind of resolution. It's really tough, but when we do find the place where politics and good policy actually do converge, well, we got to take full advantage of that. And hopefully this conversation and others that'll take place will help us in that. The other thing that's enormously important here is just I would trust Lamar Alexander with my life. I would trust George Voinovich with my life. And there's just a huge confidence and trust that's there and that's missing around this place in so many ways that I don't know how we restore that, but boy, if we could, that would be the magic elixir. The last thing, I'll close with this. I remember I'd been in the Senate about 2 years. We're having a meeting in my office in the Hart Building. And we'd invited, Ralph, we'd invited about, I don't know, 6, 7, 8, 9 CEOs from utilities across the country. And we're talking about 4P, 3P, mercury, SOx, NOx, mercury, and CO2. And finally, this one CEO from someplace down south, I don't even remember the utility, kind of an older guy, curmudgeon, I like a curmudgeon. And he said at the end of this endless meeting, he said, all right, Senator, here's what you need to do. Tell us what the rules are going to be. Give us a reasonable amount of time to figure it out, some flexibility, and get out of the way. That's what he said. Tell us what the rules are going to be. Give us a reasonable amount of time, some flexibility, and get out of the way. That's another thing I've thought about a whole lot, and I use it to try to inform me as we go forward. I think one of the great things for me that's come out of this is the ability to literally pick up the phone for Lamar and I and call the 5 of you and ask for your input, for your guidance and your counsel, and to know that you and the folks that are here in this room with you will help us. That could be hugely helpful. Sometimes we measure progress not just so much by what we get done, but the bad things we stop from getting done. And you could advise us either way, and either of those pieces of advice we would welcome. So with that having been said, I just want to say thanks to everybody who took time out of their day to join us, certainly for our witnesses, some who've come for a long ways, from folks on our staff, Lamar especially, and as my colleague, and right behind me over my left shoulder, Laura Haynes and others, Curtis and others who on our staff who worked to bring everybody together. So let's just stop there. We'll just say, I don't know if our folks from the press have any questions at all, but if you do, feel free to ask us now, and then after folks flee and head for the Dubliner or wherever you're going next, we'll have a chance to take your questions one-on-one. But any questions or comments from, yes, please.
Senator Carper, from what you've heard today and your conversations with Senator Alexander, do you anticipate pursuing legislation similar to your 3P bill and this year or in the near term?
Yeah, I'm going to go back to what that curmudgeon-y old utility CEO said all those years ago. he said, tell us what the rules are going to be, give us some flexibility, get out of the way. I learned a long time ago before I became governor, the businesses need certainty, they need predictability. They don't operate well in uncertainty. We had the opportunity, and George Voinovich and I and Lamar worked very hard in 2010, as you may recall, to try to get actually to pass legislation. So we wouldn't have to go through rulemaking, we wouldn't have to go through court battles on the regulations, we wouldn't have to go through these efforts to repeal regulations. And I thought we made some pretty good arguments as to why we should legislate at that point in time and be done with it, not have to worry about all this other stuff. And our friends in the utility basically made a decision at the end of the day that they would roll the dice, see what happened in the election, and then take their chances. And so we had the election, they rolled their dice, and now here we are. And now, rather than figuring out how to comply with the regulation, we're now hearing, well, maybe we need legislation. Well, where were you in 2010, where we did everything we could to try to get the legislation passed that I thought was pretty well informed. So I'm always open to listen to others who have different suggestions. But if we're interested in predictability and certainty, we actually have the opportunity to do some of that. If the courts are going to strike down these regs, then we'll live with that and maybe come back with something better. But I don't know that I want to say, having failed at getting legislation done in 2004, 2006, 2008, 2010, now we have the regs, now we're going to go back and legislate again. I'm not sure that's the smartest thing for us to do with our time. Although I'll say this, Lamar is one of the smartest guys I've ever worked with, so I don't discount anything that he says. Others, please. Yes, sir.
Thank you so much. I'm from Norway. I have one question. In Norway, we face the situation of indoor air quality, and we realize we have to work on 2 feet, outdoor and indoor air quality. We conducted about 50 projects. What is the status in the United States? I'm talking about hospitals, schools, residences. It's a critical issue. We did not address it across Europe seriously, not yet.
Would someone like to take that one?
It's a very important question, and we began to discover it, I guess, first in the 70s when there was an effort for energy conservation reasons to tighten house construction and close up windows and seal leaks. And all of a sudden we discovered cooking odors and cigarette smoke were pernicious pollutants at levels that you would never tolerate were they in ambient air outside. We don't regulate it in any specific way that looks at ambient consequences, but we do look at off gases of cooking utensils or stoves and things of that sort. And I think my own decision to declare side stream smoke a Class A carcinogen had a major impact on the decisions of local governments around the country to ban smoking from buildings, where in San Francisco it's banned in all buildings now. In all public buildings and office buildings. Beyond that, there is continuing monitoring and attention to that problem. It's a lesser problem here than it is in China, where it's very serious, and even in Africa, for a variety of different reasons relating to culture and how they cook and how they control their food and its consequences. But it's a problem that for a long time went unaddressed until all of a sudden we realized the places where people spent 90% of their time, they were getting more pollution than we were allowing outside.
When I was first at EPA, we were setting a standard involving carbon monoxide, and we had some indoor air pollution monitoring going on in the Riverside area outside of Los Angeles. And there was an alert issued by the local air pollution agency asking everybody to go inside because the carbon monoxide levels were too high outside. And our studies were showing the carbon monoxide was 5 times higher inside than they were outside. That didn't trigger us to do anything about it, but it certainly showed the problem.
Maybe one more. Yes, sir, please.
Yes, Randy Shostak. I'm a reporter with EOS. Newspaper of the American Geophysical Union. Administrator Riley made some comments, including that there's a series of ascientific responses to the EPA. So I'd like for some of the panelists to perhaps elaborate on whether you agree with that, why does there appear to be an ascientific attitude, and how do you deal with that?
get them, guys.
Or gals.
I see a robust technical debate frequently taking place following proposed rules and then finalization of rules. While my formal training is as a scientist, I think sometimes we inadvertently assume that the scientific process is a lot cleaner and more straightforward and neater than it really is. So in my experience, particularly with Commissioner Jackson, with Administrator Jackson, science has been emphasized at EPA. Technical analysis has been emphasized at EPA. They've made mistakes, just as my engineers make mistakes, and we have a very healthy and vibrant conversation about those mistakes during the rulemaking process. So that's my experience.
Yeah, I would just comment. I do think in the congressional debate about these issues, I think there's been a tendency to sort of undermine the degree to which science can play a role or should play a role. There's I think a broader suspicion of science, which I could get into long discussions about the tendency of the journals, for example, to publish every week a different diet problem that is now the issue, because that's the story that the journals want to publish that week in order to, and it has undermined credibility of science more broadly. I will say in the arena that we're talking about, with any flaws and other things that it has actually has been interesting to watch, because the Clean Air Act, the Clean Air Scientific Advisory Committee, the CASE Act that we talked about earlier, has actually been in some places, in many ways, a model for how to put the science together to support decision making. And in the last 5 to 10 years, actually started in the Bush administration, the entire way that that process is done has changed impressively and radically, to the point that there are much more sophisticated databases of all the latest science constantly being updated. They're constantly totally searchable. In fact, anybody can go in and use the HERO database that's there to just find what's the latest on whether it's asthma in children, whether it's a particular pollutant. So I think actually there's in some ways there's this incredible cognitive dissonance between what I see as one of the better, and I actually am on a panel of the academies right now reviewing science across EPA, and the air arena seems one of the better ones, but that isn't the way it might be seen in some of the halls of Congress. And I think that disconnect is a problem.
Okay, this is the last one. Yes, sir, please.
Hi, this is Jeremy Jacobs from Greenwire. My question is for both the former administrators. You've both now been pretty vocal in criticizing attacks on the campaign trail, and in some cases from House Republicans on the EPA. Would it be wrong to read into that you guys are concerned that one of these candidates will win in November?
If their attitude doesn't change about EPA, that will certainly give me great concern. I just don't think to take an agency like that charged with the responsibility for protecting public health and the environment and suggest it should be abolished or severely restricted in its ability. I don't think a decision like that would last longer than a year. I think something would happen and there'd be a huge demand for the recreation of an agency of that kind. And that isn't to suggest that there aren't some legitimate concerns that people have about the statutory base, a lot of which we've discussed here today, that has created EPA, the way the standards are sometimes interpreted and implemented. We can always improve in those areas, and we should work very hard to do so and acknowledge that there's not perfection in that agency, at the same time defending it. Because I just think if you got rid of the agency, there'd be a clamor to recreate it very, very rapidly.
Before this session, Bill and I had a conversation. I lamented that not one question has been asked in the debates about the environment or climate, and he said essentially count your blessings. and that's probably true. I think we all recognize certain realities of the primary season and the anxieties of the base and the degree to which one naturally whips those up for effect. One has to hope that some of them don't mean what they're saying.
So not much of a reason to support somebody.
All right, folks, let me just add a couple quick closing thoughts before I think we're going to break and have just maybe a short reception. Laura, where's that? Where's that?
Right, yeah. So we don't need to go to the Dubliner. Line here and lots of food right here.
Where do we go for that?
Just right out this door and that door.
All right, well, before you rush out, folks, let me just give this some food for thought. First, I just want to say to everybody at WRI, just a big thank you. And Manish, thank you so much to you and your folks. We especially want to thank Christina, and we want to thank Chelsea. Where's Chelsea? Back in Chelsea, thank you so much for your hard work in working with Curtis, who was with the Lamar, and with Laura Haynes, who's right behind me over my left shoulder. Sitting here, this conversation, I think, and as watching the Republican presidential primaries and that selection process, reminds me of what Winston Churchill used to say. You know, he said a lot of good things, but one of my favorite Churchill quotes, maybe yours too, is democracy is the worst form of government devised by wit of man, except for all the rest. It's really a tough way to govern. It is a tough way to govern. We've been doing this for some 200 years, and if you just have to look around, see what's the campaigns that are going on around the country. This is a very tough way to govern. Hopefully, at the end of the day, each of the parties appeal to their base and eventually find a way to get back to the middle and find common ground. And generally we do, not always, but my hope is that we will. Albert Einstein used to say, in adversity lies opportunity. In adversity lies opportunity. And even in the midst of this adversity, there's opportunity. There's opportunity, and the challenge for us, whether Democrats or Republicans in government or out, is to look at that adversity and find economic opportunity. And you know, when George Voinovich came to me, 4 or 5 years ago, and he said, all this problem we have with diesel emissions from trucks and boats and trains and so forth. He said, there's an opportunity here to create American jobs, American technology, and really help kids. And when we had like Jim Inhofe and all kinds of folks, a strong supporter for that, there was real opportunity there. So we have to be mindful of that. And the last thing I'll say, I'm a big fan of Henry Clay. Apparently I'm a distant relative, way distant relative. But there's a portrait of Henry Clay in the Senate reception room, and every now and then when I'm in there, and I'm meeting with people, I will stand under his portrait to see if Henry says, "Gosh, you look just like him." and I'll say, "Isn't he handsome?" But I read a biography of Henry Clay, some of you may as well, about a year ago. And it was just a great study of American political history from about 1800 to 1850. And we think things are tough now, folks. Just go back and read that book, and you'd feel a lot better. We're lucky we ever made it to the Civil War, much less got through the Civil War, through 2 World Wars, the Great Depression, the Cold War, and emerged, where we did in 2000. But we'll get through this too. We'll get through this too. And the key is to keep in mind one of Winston Churchill's other admonitions, and that was just never, never, never give up. And I'm not going to. I don't think Lamar is either. And my expectation is neither will anyone else at this panel, or hopefully in this room. Thank you all. God bless you.
Okay, wait. We have one announcement. You may have heard that today is a special day. It's Senator Carper's birthday. We want to recognize that. Happy birthday to you.
Happy birthday, dear Senator Carper. Happy birthday to you.
Okay, you get to, thank you. When I was a kid growing up, my parents would always say to my sister Sheila and to me, make a wish before you blow out the candle. And but I don't think we're supposed to tell anybody what the wish was. I'm going to tell you what my wish is, and then it won't come true. Okay, so then it won't come true. Here's my wish, because I know this won't come true. That in the future there will be less civility. There'll be less. Hey, we're on our way. All right. Thank you.
Cupcakes for everybody.
Woo, cupcakes for the house.